Hello, my name is Chantel Lacey, and today I'm going to be inserting a foley catheter into a female patient per doctor's orders due to neural retention after voiding. So, yeah, I'm going to go into the room. Um, I'm going to introduce myself to the patient. I'm going to explain to her why I'm here and the procedure that I'm going to do. So let's get started. Okay. I'm into the patient's room. My name is Chantel Lacey. I'm a student nurse. And today, Miss Barbara, I'm going to be inserting a foley catheter into you per the doctor's order. Due to your normal urine retention that you're having after you go and urinate, you still have abdominal distension and you're not fully emptying your bladder. So he wants us to insert a Foley catheter only for a short period of time. It's not going to be long term. So if you have any questions, you could feel free to ask me. I'm going to explain everything as I'm doing it, exactly where I'm touching you, and when I'm going to insert the Foley. So first, I'm going to start off by performing hand hygiene with soap and water. Next, I'm going to provide privacy with the curtain. Going to apply clean gloves. I'm going to get the patient in the dorsal recumbent position with her knees bent, knees apart, and feet abducted like towards her buttocks a little bit. So I'm going to start off by cleansing the perineal area using a different corner of the washcloth going from front to back. And then I'm going to pat that dry. I'm going to remove those gloves, perform hand hygiene again. And now I'm going to set up my sterile field for the Foley catheter insertion. So I'm going to have to move the camera down to do this part. So let's see. Okay. And I have my cup that I'm going to be using to demonstrate the perineal area of the female, the labia, and the meatus, which is the opening of the cup. I have my Foley catheter tray that I'm going to use, and I'm performing hand hygiene. I'm going to set this up using a sterile technique. So I'm going to pull the kit out of the bag. Normally, you would have a bedside table that you can sit all your supplies up on. So I'm going to open the sterile field, and it has the towelettes, the hand sanitizer that's on top. But I think it's supposed to be inside. So you guys can see. I'm going to perform hand hygiene. I'm going to put on some clean not clean gloves, sorry. The sterile gloves inside the packet. So This is on top, and I know I'm not supposed to be touching it, but I think it's supposed to be in the inside of the sterile field. So I'm gonna open the sterile field away from me, and then towards me, which the 2 inches, I'm sorry, the 1 inch border is non-sterile. So this will be open on the side table. No, I'm sorry. I'm gonna correct myself. This was on top because I think I would have to do this first. So I'm gonna correct myself. I'm going back, track a little. That was on top. This is for me to put underneath my client's buttock. All right, let me see. Sorry, you guys. I'm trying to think because I lost my train of thought. So this is going to be my sterile field. I'm setting up with hand hygiene. Here we have a packet of towelettes and the hand sanitizer and the drape that goes underneath the patient's buttocks. So I'm performing hand hygiene. From hand hygiene, I'm going to put on clean gloves. I'm going to take my drape that goes under the patient's buttock. From a cuff, I'm going to slide it underneath the patient's buttock. Have the patient lift their butt if they have to, and that can be placed on top of it. So I'm going to take my sterile field kit. I'm going to remove these gloves. Perform hand hygiene again. And I'm going to open up the kit, the foley kit. I'm going to open it away from me. Open up the side. Towards the patient and down. That represents the patient's buttocks here and the labia, the vagina area opening here. So now I'm going to don my sterile gloves. My hands are sterile. They're clean. I'm going to touch the outside of the box. Nothing sterile on the inside. Move this out the way a little. I'm going to form hand hygiene. I'm going to open my sterile gloves. I'm going to don them. I'm going to don my non-dominant hand first, going underneath the cuff. And I'm sorry, picking up the cuff. Only touching the cuff. Now I'm going to don my dominant hand, going underneath the cuff only, with sterile to sterile. All right. I'm going to get rid of the sterile glove. Now I'm only going to be touching sterile to sterile. So the inside of the Foley kit is sterile. So I'm going to touch sterile to sterile to move it back over to bed, closest to the patient. Now I'm going to take out the sterile drape. It has an opening. I'm going to place it over top of the vagina. In this sterile Foley kit, we have the betadine sponges that I'm going to use. It has the lubricant jelly in the tube, the normal saline water, 10 mLs to inflate the balloon with. It's a specimen cup, but the doctor's order did not ask for it. There's no need to use it. So I'm going to take this tray out. And inside the rest of the tray, we have the Foley catheter. It's going to be inserted. Start with Foley. You have this set lock to secure the Foley bag to the leg. I'm sorry, to secure the tubing to the patient's leg once you're done. And then you have the catheter drainage bag. It's going to hang below the bladder. So I'm going to set all this up. I'm going to take off the wrapper, keeping everything sterile. And I'm going to insert the petroleum jelly into the tray. I'm going to lay the Foley catheter near that. I'm going to discard this because I'm done. I am going to open the betadine packet and pretend like I'm opening it. I'm going to open it, and I'm going to have this swab stick, which is on this bottom part, the stick part, working. So now I'm going to take my, I'm going to also apply this syringe to the port to inflate the balloon. So I'm going to pre-do that before I start with the cleaning of my patient. Set that in there, keeping it sterile. Now I'm going to take the betadine sticks, swab sticks. I'm going to take one, and I'm going to take my non-dominant hand, and I'm going to identify the labia and the meatus. I'm going to separate the labia from the meatus. And I'm going to use my thumb and forefinger to separate. I'm going to take one betadine stick, and I'm going to clean between the labia and the meatus on the left, on the right side from top to bottom. I'm going to discard that one. I'm going to get another stick, clean from top to bottom in between the labia on the left side. Discard that one. And with the last betadine stick, I'm going to clean from the inside the labia from the top to bottom, the clitoris to the vagina opening. I'm going to swab down, discard that. Now I'm going to keep my non-dominant hand with that separated, and I'm going to inform the patient that we're going to now insert the catheter. I'm going to have to be 2 to 3 inches away from the tip of the catheter. I'm going to lubricate it in the petroleum jelly that's given in the tray. I'm going to find the opening for the urethra opening, and I'm going to ask the patient to take a breath in. I'm going to insert it, rotating it as I insert it. Ask them to take a breath in. Once I see urine return, which I have urine returning, I'm going to insert it 2 to 3 more inches. If I meet resistance, you turn it and ask the patient to breathe in as you're turning it to get into the urethra. Because if you reach resistance and there's no urine, then you just take it out and start over. So we have good urine output. It's inserted the extra 2 to 3 inches more. Now I'm going to hold that in place with my non-dominant hand, and I'm going to take my dominant hand or my sterile hand, and I'm going to inflate the balloon inside with the whole 10 ml syringe. Once that's done, I'm going to pull back to see if I have resistance, and I do, so it's not going anywhere. That means it's secure in place. And then I let the patient know that we're all done. I'm going to let that rest because it's in place, it's secure. I'm going to take the foley bag and the drainage bag, I'm sorry, and have that hanging below the bladder. Make sure there's no coil kinks or anything of that sort afflicting the output of flow into the drainage bag. I'm going to take the sterile lock off. I'm sorry, not the sterile lock. The stat lock off. And I'm going to put that to the side, clean up my mess, which this will all get cleaned up. And once I'm cleaned up, I remove I'm sorry, before I will clean up, that's in place. I hang the drainage bed below the bladder. I remove my gloves below the bladder. Then I can now remove my sterile gloves that are now contaminated. And I'm going to clean up everything. And once I clean up everything, I clean up everything, and then I'm going to apply the stat lock to the patient's thigh area or abdomen area, just depending on what type of foley catheter I'm using. But for this one, it's going to be placed on the thigh, and it's a 2 prong thing that it rests in. And so I'm going to attach it. I'm cleaning the thigh with alcohol, attach it, clamp it down to secure the Foley, leaving a little slack so that it's not too tight to the patient's inner thigh. And then I'm going to perform hand hygiene again, cover the patient back up, ask them if they have any questions regarding their Foley insertion as to how long it's going to stay in, what to expect. Yeah, and let them know that the bag, we will be performing perineal care once a shift, or if it's soiled with stool or anything like that, her Foley catheter will always get cleaned, and it will get cleaned from the point of insertion away from the meatus. So yeah, that's basically how inserting a Foley catheter into a female patient would work. I would discard everything, perform hand hygiene again before I leave the patient's room. I would ask the patient, is there anything that I can help them with that they might need at this time? Any concerns or questions? And then I did forget to mention in the beginning of this video to make sure that the order is correct for this patient, check identification, the armband, make sure it's the correct patient, the correct order, the correct time, what I'm doing it for, and yeah, against the MAR. So I do apologize that I forgot to mention all of that in the beginning. So I'm done with my recording. Hopefully I did everything correctly. Even though I got a little confused and had a pause, I do apologize. So I thank you for your time. And Miss Barbara is now going to be able to relieve her bladder fully without any problems and colitis within reach. So thank you all and see you next time.